The American College of Radiology is changing the future of radiology, and we would like you to play a part. For more than 85 years, the ACR has worked to promote clinical, legislative, and educational environments that help radiologists, medical physicists, and radiation oncologists provide quality patient care. The ACR is the flagship of the profession, helping members navigate a shifting medical landscape by anticipating trends, enabling positive change, and serving as the voice of radiology.
The college is taking a leadership role, and in doing so, it's affording all the college members an opportunity to advance themselves in the profession.
I think the ACR is the united force of all radiologists in the United States.
ACR members enjoy tremendous discounts on hundreds of continuing medical education products and others, including more than 160 online lectures by leading experts in the field, interactive training tools such as the mammography case review, Case in Point, RadCat, and on-site seminars nationwide.
I didn't train on coronary CTA in my residency. I didn't learn PET-CT in residency. A breast MRI wasn't available when I was a resident. All those things I have acquired through the ACR.
Members also receive discounted rates at the one-of-a-kind ACR Education Center, radiology's classroom of the future. Attendees can receive one-on-one attention at individual workstations using software of their choice and earn a certificate of proficiency from the ACR.
First 6 hours here has actually had more practical impact on my future practice than the previous 80 or 90 hours of study and preparation that I've done.
The college helps members in everyday practice with valuable tools you can't get anywhere else, available free of charge to members and online. Acr Appropriateness Criteria ranks the most appropriate imaging and treatment decisions for more than 200 clinical conditions. The radiology coding source provides coding and reimbursement information for diagnostic and interventional radiology, radiation oncology, and nuclear medicine exams. The Journal of the American College of Radiology, the Blue Journal, is the only radiology journal to focus on practice management, coding, and health policy, and ACR guidelines and technical standards, which address a variety of diagnostic, interventional, and therapeutic procedures and serve as an authority for providers in the U.S. and around the world.
It's really kind of for me, a guiding entity to direct how I practice on a day-to-day basis.
The ACR Clinical Research Center keeps radiology and radiation therapy on the cutting edge. The American College of Radiology Imaging Network, Radiation Therapy Oncology Group, Quality Research in Radiation Oncology, and ACR Image Metrics conduct groundbreaking trials that advance clinical practice. The Akron CT colonography trial proved CTC is comparable to colonoscopy at detecting cancer and precancerous polyps and could serve as an initial screening exam for colorectal cancer. The American Cancer Society has since added CTC to its list of recommended screening exams. RTOG investigators changed the standard of care by finding that for patients with less than 3 brain metastases, adding stereotactic radiosurgery to whole brain radiotherapy improved survival 33% and raised the number of patients reporting improved or stable performance by nearly 2/3. QRO has been deemed a practice quality improvement project by the American Board of Radiology, providing an extra benefit for participating radiation therapy practices. And ACR Image Metrics leverages the center's infrastructure to conduct commercial research to make new drug development more efficient. Image Metrics profits support future Acr and RTOG clinical trials that may shape the next generation of patient care. ACR members often serve as study investigators, can help accrue patients to landmark trials, and take part in events that make medical history.
The research is very important because the clinical trials are well thought out, they're well conducted, and which means that the data that is gleaned from that is accurate.
Without rigorous scientific trials, you have nothing to base your clinical decision making on.
ACR is perhaps best known for its advocacy efforts, representing your interests to lawmakers and regulatory agencies at all levels of government, as well as to private insurance companies. The college recently spearheaded legislation to avoid across-the-board reimbursement cuts and gain mandatory accreditation of non-hospital providers of MRI, CT, PET, and nuclear medicine exams. Educated Medicare staff that practice expense payments to radiologists were too low, gaining more than $100 million in necessary reimbursement for radiologists nationwide, and secured a 40% increase in payments for hospital outpatient interventional procedures, averting CMS's planned 25% cut. These victories are made possible because medical professionals like you choose to get involved.
The ACR is really crucial to making sure that we have protection and to make sure that we have people telling our story and telling our patient's story.
If we don't do it, who's going to do it? So I look at my membership in the college as an investment in my future as a radiologist.
Medical imaging and radiation oncology serve an increasing role in the American healthcare system. Join the ACR today and help ensure that your patients continue to receive the highest quality care from the specialist most qualified to provide it.
The ACR is you. The ACR is your opportunity to make a difference.
To become a member of the ACR or renew an existing membership, please visit www.acr.org/join now.